Hello and good morning. Welcome to today's video, Garrison's Steps of Prioritization, Exam Choices. I'm your host, Annalise Garrison. I'm a registered nurse with a bachelor's degree. I have gotten my certified legal nurse consulting, and I also dabble in nurse informatics. My business model is caring for you nursing services, but you might know me better as Garrison's NCLEX Review because I've been helping nurses pass their NCLEX since 1997. That's a long time. So I've been healing the community by caring for you for over 20 years. Now, I'm in my 50s now, and over the years, I have evolved into becoming an expert NCLEX facilitator. I know all things NCLEX, and I'm really excited about today's video because I've come up with a new strategy. So let's get started. This is really exciting. So Garrison's Steps of Prioritization, what is it all about? Well, when you go to answer any questions for the NCLEX, as far as the answers go, you want to think safety first. That's your first step. Safety first. Put one foot in front of the other. Second is neurological choices. The third step is physiological choices. And the last step are psychosocial choices. So let's talk about your safety is always first. What does safety entail? Well, these are the answer choices that might have to do with falls, unsteady gait, you having to put the restraints on the client, or the client removing the restraints, anything with confusion. All of these things are safety, right? So any answer that puts an individual at risk for danger to self or others is a safety issue. And for the NCLEX, safety answers always come first. So let's look at an example. The nurse is assessing a 72-year-old client who has a blood pressure of 182/92. Which of the following findings would be a priority to follow up? So those of you that I've been tutoring, the first thing you got to do is you have to decide, is the NCLEX asking me to pick a correct answer or to pick something incorrect or something that's wrong with the patient or wrong with my actions, right? So, follow up. We're looking for something wrong. We're looking for something that we have to intervene, right? So, remembering that safety is always first. His ability to recall a 24-hour diet history. Just thinking about this strategy. Is asking a person to recall his 24 diet history a safety issue? No, it may be a neurological issue, or it may be something that we have to do, a physiological issue, but it's not a safety issue. So we know that A is a physiological issue. So let's look at B. Double vision and unsteady gait. Is that a safety issue? Yes. Double vision might be a neuro issue, but unsteady gait is a safety issue. C. Numbness and tingling in the fingers. What is that? That is a neurological issue, right? We already know that there's a safety issue in our choices. Safety is always first. And episodes of urinary frequency. First of all, that is not only does it have nothing to do with the question, but is that a safety issue? No. Is that a neurological issue? No. episodes of urinary frequency is something that we're going to have to do. Measuring the urinary frequency, right? Or writing, whatever. It's a physiological need. So, the answer for this choice is B. Double vision, which is a neuro issue, and unsteady gait, which is a safety issue. So, the answer is B because safety is always first. See how easy it is? Alright, now let's go to the next step that I came up with. In Garrison Steps of Priority, first step is safety choices, second step is neurological choices. Alright, let's look. What do I mean when I talk about it, the neurological choice? First of all, don't forget, ask yourself, is the NCLEX asking me to choose a incorrect statement or a correct statement, intervention or action? And then neurological choices, answers, would have things like neurochecks. These would be maybe anything head injury related. It might actually have neuro assessment in the answer, right? So any neurological disorder symptoms is a neurological choice. And a neurological choice is the second step in our hierarchy of steps, right? Now let's look at an example. The nurse has been made aware of the following client situations. The nurse should first assess the client who is being treated for a gastrointestinal bleeding and is reporting having tarry stool. Again, is being treated. That's a physiological need, right? Alright, we know that physiological needs is the third step in Garrison's steps of prioritization, right? So, has not voided since an indwelling catheter was removed 6 hours ago. Well, not only is this not a problem, it does become a problem if it was 7 hours ago, but it could take up to 6 hours for a person to void. But let's say you didn't know that. So B is a physiological need. We have to do something for that person. Alright, so we have two physiological needs. Look at C. Is confused and has unfastened the prescribed vest restraint to go to the bathroom. Alright, Garrison said safety first. The person being confused, it may be a neurological issue, right? And has unfastened the prescribed vest restraint. So with C, we have a safety issue and a neurological issue. Now let's look at D. Has not had a bowel movement since a prescribed oil retention enema was given an hour ago. This is something we have to do for our client. Again, so D is a physiological need. So A is a physiological need, B is a physiological need, D is a physiological need. C has a safety issue and a neurological issue in the answer statement. So here, the answer is C. Safety is first, neurological is second. All right, good job, good job. Now let's go to the third step in Garrison's steps of prioritization. Safety choices are first, neurological choices are second, physiological choices are third. Now what do I mean by physiological choices? This is the choice. This is anything you have to do for your client, right? It doesn't matter if the question is a care plan question, a conference question, a follow-up question, or whom would you see first. For those of you that I am tutoring, you know that the first thing you have to do when approaching the NCLEX is Is the NCLEX asking me to pick something correct, a correct statement, a correct action, a correct intervention, or is the NCLEX asking me to pick something that's incorrect, an incorrect action, an incorrect statement, an incorrect intervention, or a problem, right? And I've taught you words that would tip you off. So first thing you got to do is the NCLEX asking me a correct or an incorrect answer. Number 2, remember my steps of prioritization. The third step is physiological needs. Physiological needs is anything that the nurse has to do for the client on the NCLEX. So now let us look at an example of what I'm talking about. See, if you remember these steps, when you get stumped on the NCLEX and you don't know, like, oh gosh, I forgot Huntington disease, or oh gosh, I forgot this, I forgot that, just follow these steps and you'll get the answer right. So let's look at this example. The nurse has been assigned to the following client situations. The nurse should first assess the client who has. Now, this is hard to do. You got 4 people. They all need attention. Who would you look at first? Look at A CVA 48 hours ago and is receiving oxygen at 24% via ventricular mask and has a POCO2 of 55. All right, whether you knew that that lab value was too high or not, don't worry about that. What I want you to think about is, oh, this is a physiological need. This is something that we have to do for our client, right? Someone put the oxygen on that person, right? So this is a physiological need. Let's look at B. Open reduction and internal fixation of a left hip fracture 12 hours ago and is reporting incisional pain rated an 8 on a scale of 1 to 10. Tutoring and learning my concepts would be very important because there's a couple of concepts I have about pain, which I will discuss later. But the biggest concept I have is do not pick pain. If there is a physiological need in the example, I'll talk about pain when I get to that step. So, A is a physiological choice. B is a psychosocial choice because it's talking about pain. So, let's look at C. A chest tube inserted 12 hours ago for a hemothorax and 100 milliliters of dark colored drainage in the collection chamber of a closed chest tube system. So, we don't need to know all about chest tubes. What we do need to know is this is an assessment. This is a physiological choice, right? Something we do for the client. We put the chest tube in. By the way, let me just digress for a minute and talk about chest tubes. A couple things you need to know about the chest tubes. Okay, bubbling in the collection chamber, the NCLEX is not going to ask you. It's all over the internet. It's in every book. It's on every app. We know that the seal is broken on the chamber. So, what I do want to tell you about chest tubes is, if it is draining 100 cc's or more an hour, report that to the MD because that could be an internal injury. All right. The other thing I think is important to know about chest tubes is you can DC a chest tube if it's draining 150 milliliters or less in a 24-hour period. So while C is a physiological need, there's nothing wrong with C because 12 hours plus 12 hours is 24 hours, so that this person would be draining 200 milliliters in a 24-hour period. This is fine. It doesn't matter how much is draining in that chest tube collection chamber. The only thing you need to know is if it's draining more than 100 milliliters, report that, because that could be an internal injury. So not only is C correct and doesn't need any assessing first, but there's just nothing wrong with it. A, the POCO2 is a little high. So we have two assessments. A is a little high, and C is fine. Now let's look at D. An appendectomy 18 hours ago and has a temperature of 101.5. Well, if I've been tutoring you, we all know Annalise said one of her concepts is don't pick temperature. So, if there's nothing wrong with C, that's a physiological choice. If Annalise said one of her concepts was don't pick temp, even though D is a physiological choice, Annalise said don't pick temp, so D is out. B is pain. Annalise said don't pick pain. 7 out of 10 times pain will not be the answer. So the only choice you're left with is A. A is a physiological need, and the POCO2 is a little high. Alright, so that is the third step in my Garrison's steps of prioritization. So we've gone over safety, we've gone over neurological choices, we've gone over physiological choices, and I've given you an example of all of these. Now let's go over psychosocial choices. So what am I talking about when I say that you pick your psychosocial choice last? This is anything the client tells you they are in pain, right? So a psychosocial choice has to do with pain. This might be why you missed your NCLEX last time, or even for those of you that are taking it. Psychosocial choices always get picked last. Now let's talk about pain, because 3 out of 10 times pain is the answer. So, for those of you whom I tutor, I keep saying tutor, the fact of the matter is, you're watching this video for free, but at some point, if you're really serious about taking the NCLEX, you're going to have to get professional help. And who's more professional than someone who's been helping with the NCLEX for over 20 years, right? So, one of my concepts is there should never be more pain after a medical intervention than before. You know, the client's reporting more pain after surgery, there's a problem, right? The client's reporting pain with his IV site, there's a problem. The client is reporting a headache, there's a problem, right? All of these things are pain. So, and this also includes the choices where the nurse is giving the medication or the client is asking for medication. And also with psychosocial needs, any communication falls in this step. Alright, so let's look at an example of a psychosocial question. The nurse has received the following information about assigned client. Again, the nurse should assess the client who? With ulcerative colitis, who's reporting having bloody diarrhea. This is a physiological need, right? Not only do I have a concept about don't pick the symptom of the disease, pick acute illness over chronic illness. These are some of my concepts, right? So not only is this a concept, but it's a physiological need. choice. Make a mental note of that. With lung cancer, who is reporting expiratory rust-colored sputum. Okay, this is a physiological need. I know I said that in the steps that physiological needs come first, but you also have to remember my concepts. And one of my concepts is never pick the symptom of the disease. So simply because of my concept, you will not pick A, that's a symptom of the disease. You will not pick B, that's a symptom of the disease. So let's look at C. Who had a percutaneous transluminal angioplasty, or PTA, 4 hours ago and is reporting flank pain. Okay, that's a psychosocial need. All right. And who had a partial thyroidectomy 3 hours ago and is reporting incisional pain at a level of 6 on a scale of 0 to 10. Now, after you have ruled out my concepts, of which I have 50 of them, so we know we don't pick A, we know we don't pick B, but now we've narrowed it down to 2 pain answers, which is a psychosocial need. So, when this happens, remember I said 3 out of 10 times pain is the answer, and you always want to pick the level and the scale. So the answer for this example, the psychosocial answer, is D. Very good. So it's just that easy. So, remember what I said. There's 3 things you have to do when for the NCLEX. Are they asking you to pick a correct or an incorrect answer? And if you got tutoring, I went over the words that will be a clue as to whether you are supposed to pick an incorrect or a correct answer. The second thing you want to do is to remember Garrison's steps of prioritization. And what are they? Let's put one foot in front of the other, right? Safety first, left foot. Neurological issues, right foot. Physiological issues, left foot. Psychosocial issues, right foot. Let's do it again so we can remember. Garrison's steps of prioritization. Safety is always first, then your neurological choices, then your physiological choices, and then your psychosocial choices, which has to do with pain or anything, maybe therapeutic communication, anything like that. Now, you can find all of my concepts on SoundCloud. So I do have them up on the internet. But like I said, if you're really serious about the NCLEX, you're going to have to get tutoring. You're going to have to get some type of review. But the problem is that I noticed that reviews are popping up everywhere, and it's very confusing to you. You don't know who to choose, right? So I would say to you, please choose the review that's been around for a while. Now, if you're watching this video, you've probably already taken Hearst. You've probably already taken Kaplan. You've probably already taken blah, blah, whatever you've done, right? By the way, I don't consider ATI a review. That's a good review for content, but not concepts. And to pass the NCLEX, you have to get 50% of the expert questions correct, not the college questions, right? Expert questions are a step above what you learned in college. And so I don't consider ATI or HESI a complete review, because ATI and HESI do not teach concepts. I have really become an expert on concepts, okay? So like I said, my concepts are on SoundCloud. But who do you choose? There's so many reviews. Review this, review that, buy this app, get this book. UWorld's great, Remar's great, Hearst is great, Kaplan's great. Okay, maybe they are, right? Betty Sue in Ohio is great. Michael Flynn in California is great. Maybe they are, but I'll tell you something. Reviews are popping up left and right. And they're young. They're 5 years, 7 years. What do they really know? What do they really know? Did they fail their NCLEX? Oh, let me help you. I passed my NCLEX the first time. That doesn't mean they can really help you. Retired doctors can't really help you. Retired instructors can't really help you. Just because they're an instructor, do they really know the NCLEX? And over the 20 years I have evolved, you can see I have evolved to really be an expert NCLEX facilitator. You could go to YouTube and view what's new on the NCLEX. You could go to Anchor, listen to my podcast, NCLEX and All Things Nursing. You could go to SoundCloud, NCLEX Review Podcast. That's where my 50 concepts are. And all this is free, right? So imagine how much better you would do if you actually got tutoring from me. I have a Facebook page. I have a Google Plus account. I have a Twitter account. I have a Pinterest page. If it's on my Pinterest page, someone had it on their NCLEX. I have an Instagram account. And after all that, I even have a Pearson VUE group. So if you've taken the NCLEX, I even make sure you're covered with the aftercare. And we all help you with, just venting on how your NCLEX was, because everybody is so exhausted and scared and needs a hug and support after they take their NCLEX because they don't feel that they passed it. Alright, so this is the end of this video, and I want to thank you guys so much for watching this video. And thank you for giving me the opportunity to share what Garrison's steps of prioritization when it comes to your exam choices. God bless you on your nursing journey, and I'll see you somewhere on the net. Please follow any of my social media. I'm everywhere.